Hello everyone, today I'm going to talk about the signs and symptoms of GIT disease of a patient. So, what is a GIT? GIT is a short form of gastrointestinal disease. So, gastrointestinal disease, it affects the gastrointestinal tract, which is the GI tract from the mouth to the anus. There are main two types of GI disease, which is functional gastrointestinal disease and structural gastrointestinal disease. Some examples of the gastrointestinal disease is nausea, vomiting, food poison, diarrhea, and lactose intolerance. Functional disease are those in which the GI tract it looks normal when examined, but the GI tract it doesn't move properly. So they have the most common problems affecting the GI tract, including the colon and the rectum. Constipation, irritable bowel syndromes, which is the IBS, nausea, food poisoning, gas, bloating, diarrhea, and so on. The factors that affect the functional gastrointestinal disease is eating a diet with a low fiber, not getting enough exercise means that the patient have no regular exercising, the traveling or other changes in the routine, the patients may eating a large amount of the dairy products, and stress also causing it, and also the overusing of the anti-diarrhea medications that over time it weakens the bowel muscles movement, and this symptoms is called motility. And taking some medicine contains too much of calcium or aluminium, and pregnancy. So next one, we are moving to the structural gastrointestinal disease. So structural gastrointestinal disease are those where your bowel it looks abnormal upon to the examination, and also it does not work properly. Sometimes the structural abnormality needs to remove surgically. Some common examples of the structural gastrointestinal disease including stenosis, hemorrhoids, diverticular disease, colon polyps, colon cancer, and the inflammatory of the bowel disease. So the main functional problems of the structural gastrointestinal disease is the constipation. Constipation, it makes it hard for you to have a bowel movement to pass the stool out from your body. So the stools are infrequent, or it is incompletely to pass it out. How infrequent it is like less than 3 times a week, or even worse. So constipation is usually caused by inadequate roughage of fibers in your diet, or a descriptions of your regular routine, or descriptions of your regular diet. Constipation, it causes you to stain during a bowel movement. It may cause a small hard stool, and sometimes with an other problems such as fissuras and hemorrhage. So how you can treat the constipation by increasing the amount of your fiber and water of your diet, exercising regularly, or increase the intensity of your exercise as tolerance. Next, we are going to talk about IBS, which is the irritable bowel syndromes. So this syndrome is also called as spastic colon, irritable colon, IBS, or we call it as a nervous stomach. It is a functional condition where your colon muscle it contracts more or less than the normal one. So certain food, medicines, and emotional stress also cause this syndrome. So the symptoms of the IBS includes that XSL, a abdominal pain and cramps, a change in the bowel habit such as a harder, looser, or more urgent stool than normal, and also an alternating constipation and diarrhea. There are also some treatments to cure this IBS. The treatment included avoiding excessive caffeine, and also increasing the fibers in your diet, monitoring which food is triggering your IBS and avoiding it, and minimize the stress or learn the different way to cope the stress, and also take medicines that are prescribed by your healthcare provider, and also getting a higher quality of rest and a higher quality of sleep. How can a gastrointestinal disease be prevented? Yes, because many diseases of the colon and rectum can be prevented or minimized by maintaining a healthy lifestyle, practicing a good bowel habit, and also getting a screening of cancer. That's all for my presentation. Thank you for listening. Good